Hey, this week on Pharma Harma, we're talking about steroids. Now, steroids are commonly prescribed to help with pain after surgery. So if you've got a surgery scheduled, you've been through surgery, it's oftentimes a very real possibility that your doctor will use a steroid post-surgically to help you overcome pain and to reduce some of the swelling associated post-surgically as well. Now, the problem with that is steroids have been shown to deplete a number of different vitamins and minerals. These very same vitamins and minerals are necessary for you to heal and repair. So let's look at this here. We'll put this on the screen. So steroids can cause vitamin D deficiency, calcium, magnesium, potassium, selenium, zinc, chromium, vitamin C, and folate deficiencies. Now, these have all been studied and documented pretty well in the medical literature, and this is one of the reasons why steroids pose such a complicating risk factor post-surgically, because they can actually cause nutrient deficiencies, inhibiting your body's ability to heal and repair. Now, check out this study here. This was published in the Journal of Foot and Ankle Surgery, and so you can see here use of post-operative steroids to reduce pain and inflammation. And then their summary here, which is studies have shown steroids to delay healing, inhibit collagen synthesis. Remember, all of your functional tissue, your skin, your soft tissues, the things that doctors cut through when they do surgery, these are all collagen-based tissues, and steroids inhibit collagen synthesis. They also increase the risk of post-operative infection, because don't forget, one of the things steroids cause is immunosuppression, so it makes you more likely to pick up a secondary infection. Now let's look at another study here, and you can see that their conclusion was there was a 4-fold increase in wound complications in the group of patients using a steroid paste. So in these particular post-surgical cases, they were applying a topical paste steroid to reduce the edema and to reduce the pain and swelling, but that led to a 4-fold increase in risk of infection. Now we got another study for you, evidence of drug-nutrient interactions with chronic use of commonly prescribed medicines, and you can see down here, in conjunction with an overall healthy diet, appropriate dietary supplementation may be a practical and efficacious way to maintain or improve micronutrient status in patients at risk of deficiencies, such as those taking medications known to compromise nutritional status. And again, what we were talking about earlier, steroids cause a plethora of different mineral and vitamin deficiencies. And let's look at one more. This was on chromium. So this is important because one of the side effects to using steroids is diabetes. Steroid use, corticosteroid use, elevates blood sugar, putting an increased demand on your body's chromium storage. And so it's been shown, if you look here, steroids, these data demonstrate that corticosteroid treatment increases chromium loss, and that steroid-induced diabetes can be reversed by chromium supplementation. Again, all these things add up to one fundamental thing that you need to understand, especially if you're scheduled to undergo surgery, which is have a conversation about your doctor as to whether or not they plan on using steroids in your post-operative or during your surgery, so that you can assess the need to supplement extra so that your body doesn't end up with slower healing times, increased risk for infection. Is very, very important if you want a successful outcome.